Hello, welcome to the James Cooley Show. It's your life. I'm your host, Dr. James J.C. Cooley. Guess what? It's Thursday. I mean, it's Wednesday. Wednesday, Wednesday is 360-degree health. And you already know that. We got the world famous Dr. Michael Mantell here again. You know, guest co-host. And I miss chatting with you, Doc. Miss chatting with you. How you doing?
I'm doing well, sir. Good to talk to you and Michelle. And I'm very excited about today's show. We have one of the leaders in the field that we're going to be talking about. And she's a hero of mine. I follow her all the time. And I'm sure that after people spend a little bit of time listening and learning from her, they're going to be following her as well. So I'm going to turn it back to you folks and let you take it where you want to go.
Yeah, I'm excited about this guest, and I know we did a little bit of our research. Michelle did a whole lot, and I'm just excited about what she bringing to the table, the education she gonna teach us. I'm gonna tell people right now. I know, Doc, you're gonna get mad. Grab you about 7 or 8 bags of popcorn because she is gonna bring it. And no, it's not the movies. It's not the movies. And make sure you don't put any butter on that popcorn
or salt. Or salt.
You know, so like Doc, you know, we can't even get this started without the executive producer introducing the guest, the title, and just doing her thing. So how are you doing, Dr. Michelle Cooley?
I'm doing great, doing great. Just talking to the guests before we became live on the show, and very interesting topic, and it can apply to anybody, the specific topic, but she's kind of going to discuss a specific target audience regarding this particular topic. So we're really excited to have her on the show. And you ready?
Yeah, can you go ahead and introduce the title of the show, the purpose of the show, and introduce this absolutely fantastic guest?
Oh, most definitely. So it's 360-degree Health Day. Stress Less and Thrive is the title of the show. And Dr. James Cooley, myself, and guest co-host Dr. Michael Mantell will have a sit-down discussion with Dr. Robyn Tiger. She's a double board certified physician, diagnostic, radiology, and lifestyle medicine, founder of the physician wellness practice StressFreeMD. She's a speaker, CME Program Creator, author, and physician well-being coach podcaster. Wow. She's going to talk about why physicians need to put on their own superhero capes, the connection between stress, illness, disease, and longevity, her bottom-up, top-down method for stress relief and well-being, lifestyle medicine self-care formula every physician should know, the bidirectionality of stress and its relationship to lifestyle choices. So again, Dr. Robyn Tiger, wow, her innovative trauma-informed CME courses, coaching, presentations, retreats, podcasts, and upcoming book focus on the key topics of stress relief, nutrition, fitness, sleep, social connection, risky substances, and nature. She serves as lead faculty and subject matter expert in stress management for the Foundations of Lifestyle Medicine Board Review Manual and Western Carolina Medical Society Healthy Healer Partner. Her strong desire to help physicians grow out of her many years in medical practice, experiencing and witnessing firsthand the need for physician self-care education. She's deeply compassionate about successfully guiding physicians to become the best versions of themselves and live their healthiest, longest, and most fulfilling life. Please welcome to the show, Dr. Robyn Tiger.
Oh, thank you so much. What a privilege to be here. Thank you.
Robyn, you are honoring us by your being with us today. And we have so much we're going to learn from you. I'm just so thrilled that you're here. And we've had numbers of your colleagues with us before, what we talked about before, but it's a special day to have you today.
This is a special day for a couple of reasons, Doc. You know, today is Juneteenth, as we all know that. And to have professionals like you, not just celebrating the day, but also giving out advice to folks that really need to understand this. And also, hopefully, we got a lot of doctors listening here today to learn about this great message that you're getting ready to deliver. So welcome to the show. Welcome to the show.
I feel so welcome. Thank you.
Hey, Doc, can you tell our viewers and our listeners a little bit more about you, where you grew up, what made you click, and why you're so passionate about what you do?
Yeah, well, I grew up in Pennsylvania and then spent a lot of my time in New Jersey. And more recently, about 5 years ago, I moved to Asheville, North Carolina, as the mountains were calling, as well as peace and a more stress free life. I am dripping with passion in what I do because, well, as the saying goes, make your mess your message. And so, full disclosure, I was a very burned out doc over a decade ago. And I had lots of symptoms and illnesses that our colleagues just couldn't figure out. I was taking lots of medications. I had lots of imaging studies that were normal, lots of blood tests that were normal. Nothing was making me feel better. And I needed to figure out how to help myself in that moment. And having three physician colleagues sadly die from suicide, I thought, gotta take time to really forge my own path and to turn my life around. And so when I did, I decided I needed to help others do the same.
That's fantastic. That's fantastic. Where in New Jersey did you say you were from? You were living?
Yeah, I was living in South Jersey in Galloway, which is about 15, 20 minutes outside of the Atlantic City area off the
Right.
coast.
I was raised in northern New Jersey. That's why I asked, and lived in southern Jersey for a while. But JC mentioned that it is Juneteenth, and I think it would be so important for us to just to comment on Juneteenth because it highlights the rich cultural heritage of African Americans, emphasizing the importance of cultural identity and pride. One of the things that concerns me, of course, and I'm sure it concerns you, is the area of health equity and what we can do to make sure that we are eradicating health inequity. Juneteenth reminds us of the enduring legacy of systemic inequities and the ongoing call that we all have in each in our own professional areas to dismantle them. Can you talk a little bit about that and how you see health inequity adding to stress, adding to illness, and curbing health?
Yeah, I mean, it breaks my heart to know that people aren't being treated equally, that people's pain is not being perceived as equal based on the color of your skin, the language you speak. And that's stressful, right? It's stressful for any human to know that even before going in for medical care, that they have to be concerned about not being treated equally, not being heard, not being listened to, not receiving the same care. And, I think we need to all just take a step back and realize that we're all humans. As a diagnostic radiologist by my original training, I can assure you that I've looked in thousands of bodies through my imaging, and we are all the same on the inside. We
That's
really are.
beautiful. That is so beautifully said. I always say we have to look beyond the outside to that which lies within. And when we do that, we're all human beings. And it's heartbreaking to see. It's just truly heartbreaking that people don't have access. They are turned away. And yes, look, color is a big part of this, of course, but we see it also with size. People who have obesity, people who have other difficulties. We need equal accessibility. And let's hope that this Juneteenth, we will look back upon and say, boy, we really made a difference over this past year. So with that said, I appreciate your comment on that very much, Robyn. Let's talk a little bit about the StressFreeMD. What is StressFreeMD?
Yeah, StressFreeMD, the name actually came to me during a meditation when my mind was on pause from the busyness. And It really is the umbrella under which all the different ways that I educate others on ways to prevent and relieve their stress live. Stress is the direct cause of most of the chronic diseases in the world: hypertension, diabetes type 2, heart disease, stroke. It causes cancer progression and growth. It's associated with dementia, and it even shaves years off of our lives by directly affecting our telomeres, the little protective ends of our chromosomes. And so it's imperative, with the epidemic of chronic stress continuing to rise, that people are educated on how to actually relieve it.
When you talk about, you made such a profound statement that stress is related to all of these illnesses and difficulties in life. And yet we hear it, and we hear it, and we hear it. We see it everywhere we go. You can't go anywhere without knowing, yes, stress is not good for us. But yet we continue to ignore it, or we just don't really apply the knowledge that's there. What thoughts do you have about that? What can we do to help, particularly physicians, but also everyone else, really apply the knowledge that is there?
Yeah, it comes down to, I like to break things down into digestible pieces of information, right? And so it's what, why, and how that get people to really embrace a behavior that's good for them. There's a lot of what. What I mean is, like, stress is bad for you, right? Stress is terrible for you. I just told you that stress is associated with all of this chronic illness, and it makes you feel terrible. Palpitations and sweats, and your body hurts, and you can't sleep, and you're reactive, and you can't digest your food, and all these symptoms that people experience. And then there's the why. Most people don't really understand the why. Number one, why is it important? Well, it directly affects your health, right? For healthcare professionals, there's a second why, which is, why does it work? Why do the tools to relieve your stress work? Because they have their left brain hungry for that why to make it credible and authentic. And then there's the how. And the how is, well, you're telling me what the problem is.
Hey, Dr. Robyn, hold that. Oh,
He's got to pay the bills.
we got to take a station break. I was locked into that. And you know what? I tell you, we're going to take a station break. We're going to come back. And Doctor, you got to ask that question again, because Dr. Robyn, she was on the road. So if you want to be part of the conversation, regardless of which platforms you're watching us on, whether you're watching us on E360 Television, Frankfurt TV, YouTube, LinkedIn, Twitter, over 67 live platforms. Welcome to the show. If you want to be part of the conversation, just go to the comments. Ask any question that you might have. I promise you we'll get you an answer. Remember, it's your life, and we'll see you shortly after the break.
It's Dr. JC Cooley. Hey, let's go. The J. Cooley Show. It's your life.
I've seen a smile convey I love you. I'm proud of who you are. One that keeps us close when we're apart. Talking from the darkness of all that we've been through. It seems that there might be a way to leave behind the loneliness we've known and live again. Life of
really get a chance to know who you are. And once you know who you are, you truly know who you are, love who you are. Love who you are. You're a masterpiece. Love who you are. Love who you were born to be. Love me some me. That's what I'm talking about. When you leave high school, you gotta know today or tomorrow, hopefully today, what your plans are. Hopefully, there is no bad decision unless there is no plan. Create, collaborate, commit with confidence. Commit with what? Commit with what? And everything that you do.
Hello, welcome back to the James Cooley Show. It's your life, and I tell you, I was locked in and almost missed the commercial break. I mean, that's just how intriguing and how good that discussion was going. And Michelle had to remind me, "Hey, James, are you going to take a break?"
We're starting to increase your stress level, but Robyn was presenting so well. Michelle, you have a question.
You're on mute. You're on mute.
Dr. Tiger, I think she was finishing up a question that Dr. Mantell addressed to her before the break. So I just wanted her to finish her thoughts on that. Can you repeat that question, Dr. Mantell?
No, I can't.
Don't stress. I got it.
I was so enwrapped with your answer. The question was about, I guess, in a sense, what is so important about taking care of physicians in particular when it comes to stress? That's where you're going. And I wanted just to add on to that. People may say, oh, this is just for physicians. But when physicians are stressed out, what happens to us? So, Robyn, perhaps you can pick up on that.
Yeah. So just going back to when we were so into our conversation before, I was talking about the 3 components that I thought were really important. In your question had to do with, well, why aren't, I think, physicians embracing this, or why aren't they taking care of their stress? And so we talked about what, which is defining the problem. Here we're talking about stress, and we talked about why, which was, why is it important as it's related to our health and well-being, and why do the tools work? Because the left brain needs to be spoken to for authenticity and credibility, and so that it's not woo-woo, it's not really just made up, but it's actually based on our anatomy and physiology. And then the third piece, which is the missing piece most of the time, is how. People are saying, stop telling me to relieve my stress, stop telling me to sleep better, stop telling me to eat better, stop telling me to exercise more, and so on. Tell me how to do those things. And so that how piece is really, really missing. And going to your next question about why is this so important for physicians and healthcare professionals to prevent and relieve their stress, and how does it impact their patients? Well, one, we have to remember that we're all humans, right? Remember the skeletons we were talking about, the images, right? So inside our bodies, we are all humans. Physicians, other healthcare professionals are humans too, and they get sick too. We are not completely abstained from illness related to our stress. So it's really important that healthcare professionals recognize that they need to take care of themselves first. They need to put on their own oxygen masks first. They need to fill up their own cups first before they can care for others. And secondly, is really interesting in that, how does it impact patients? Well, research shows that if physicians are taking care of themselves, patients will want to emulate that. And secondly, if physicians are taking care of themselves, they are more likely to educate their patients on how to take care of themselves. So research backs the importance of actually physician with respect to their patient interactions regarding their own health and well-being.
Wow. Dr. Tiger, when an individual decides to go into the medical field, and my brother's a pediatrician, and he told me about his experience. It's tough. It really is tough. Lack of sleep, always on rotation, especially as a medical student. Do you believe, in your opinion, that whatever medical field an individual goes into, that maybe they're not prepared, the people who are teaching them are not preparing them for the enormity and the responsibility for their role in the medical profession? And is help available to them?
Yes, you're absolutely right. I believe there's this huge gap in education. And again, going back to research shown comparing students that graduated college, they divided those students up into those going to medical school and those who were not. And actually, those going to medical school were healthier mentally, physically, had a greater quality of life than those who weren't. So there's the argument that, oh, they're so burned out because they've been working really, really hard in college to get to medical school. They're coming in that way. And the truth is, they're actually coming in healthier in most of the time than those who aren't. So it is the system that the students are going to that begins the deterioration in the physical, the emotional, psychological, and ultimately the spiritual or the soul that makes medical students early on in their career not well. And I do believe that education should be intracurricular. It should be part of anatomy, physiology, pharmacology, everything that we're being taught. Self-care should be equally important and equally taught. There are a very few medical schools that are beginning to do this work, and USC versus South Carolina here in Greenville is a prototype where they actually have a lifestyle medicine-based medical student curriculum where these medical students are being taught how to care for themselves and therefore how to care for others, which is really, really exciting. And we need other medical schools to follow along and follow their prototype.
Hey,
For those who may not know, would you just quickly define lifestyle medicine for us?
Yeah, lifestyle medicine is a really exciting specialty of medicine that looks at medicine a little bit differently, a lot differently. In traditional medicine, Western medicine, which I am trained, Dr. Cooley's trained, and we both strongly believe in Western medicine, but it's not perfect in the sense that Western medicine is a disease management system. And what I mean by that is someone comes in with a headache, they might get a medicine pill for that, right? Someone comes in with gastrointestinal or, trouble digesting their food, belly pain, they may get a pill for that. Somebody comes in with back pain. Somebody comes in with diabetes or high blood pressure. And lots of times it's what we call a pill for an ill, right? And lifestyle medicine says, whoa, okay, sometimes we need medication, sometimes we need procedures, sometimes we need surgeries and so on. But most of the time, we need to get to the root cause of why these symptoms and illnesses are happening in the first place. And when we get to the root cause, we can actually decrease and even reverse what the patient is experiencing and even prevent symptoms, illnesses, and diseases in the first place. And that's by focusing on key behaviors. And they include stress management, healthful nutrition, which is predominantly a plant-forward or plant-centered eating pattern, nourishing sleep, appropriate exercise, social connection, avoiding risky substances, and I like to include nature, which is my dear friend Melissa Sunderman, who I know has been a physician guest on your show as well. Nature is medicine, and really focusing on these 7 components helps individuals prevent, reverse, and sometimes even treat their symptoms, illnesses, and diseases. So it's a very exciting time in medicine to recognize the power that the human has in over their health and well-being.
Doc, now you mentioned, I mean, I know this is a lot about physician burnouts. And a lot of people, like doctors, they say the word. They don't burn out. They don't get tired. They don't have any problems. Yeah, yeah. Can you explain to our viewers and our listeners that it doesn't matter what career field you might be in? When doctors are saving lives, they are still human beings as well. So, what would you call the bottom-up, top-down approach to stress release, regardless of what career field you might be in?
Yeah, so first I want to acknowledge what you said. We're all humans, right? And we all experience stress. And whether it's symptoms of stress, where you want to call it burnout, whatever you want to call, stress affects all of us in some way, shape, or form. And over the years, when I started with my own recognition of my symptoms being caused by stress and relieving them, I started with understanding my body better. And that began actually with my starting to take some yoga classes, which I have to say, I was a gym rat, still am. I was eating a relatively what I thought to be healthful diet. And I needed to find something else to help me. And so I went into this Yoga 101 series being taught down the road from my home by an anthropology professor from a local university. So my left brain was like, okay, she's got to be credible. She's not some Molly Moonbeam person, right? And I saw this whole transformation in how I was feeling, even just after one session. So I said, oh my gosh, what's going on? And I started to dive into all of my textbooks. We didn't have Dr. Google at the time. And so I was looking at my textbooks and I came to understand that it was stress that was causing my symptoms, and that starting to understand how to work with my own physiology and my own anatomy helped me to start relieving that stress so that my symptoms got better. So that was my beginning of understanding the body, and that continued into meditation, a very body-based meditation that I was taught and became certified in as yoga therapy, becoming certified in that. Originally created for our military. Actually, I know, Dr. Cooley, you are a veteran, and this meditation was created for Walter Reed Army Hospital, our military hospital, help our military relieve their suffering from PTSD. And it was found to be very effective for chronic pain, because so much of the pain that we feel in our bodies comes from our thoughts and our stress. So the bottom-up approach initially started with understanding physiology and anatomy and how to use tools to bring balance back into our bodies, our stress and our relaxation responses, two key components of our nervous system. And then once we are calm in our bodies, we can start to work with our thoughts. And I do that through mindset work, through life coaching. And that's what I call that top down. It could be really, really hard to work with those 60,000 thoughts per day that you have. Not so nice. Your brain's not talking nicely to you most of the day. Well, you can really work with them first when you calm your body, and your body is much more calm. Then you create space in your mind to work with those thoughts. So that's what I call that bottom up, top down approach. I mean, who here knows what it's like to be wigging out about something, right? What does that feel like?
Well, hold that thought. Hold that thought, because you got to come back. I want to hear Dr. Michael Mantell about freaking out and weirding out, and myself, and get Michelle's point of view on that one. So what we're going to do, we're going to take a station break. But we're going to come back. We're going to pick it up. This is absolutely fantastic. And I hope that you all enjoying this just as well as I can. And I tell you, if you want to be part of the conversation, continue to watch, and I'll tell you how you can do that when we get back. It's your life, and we'll see you shortly after the break. I'm Dr. James J.C. Cooley from the United States of America, and I am here to just say, first of all, I'm so happy and honored to be honored to be in the Coffee Book 2023. Unified Brain Z and the other organizations, thank you so much for giving me an opportunity to be a part of this collection.
In this life you are gonna grow, but there's things in this world that you gotta know. To be the best that you can be, you wanna grow real big into a strong tree. To be who you're created to be, the one who's gonna leave a legacy is you. But you got to have these 4 C's. Create, collaborate, then you commit with confidence. Create, collaborate, then you commit with confidence. It's the 4 C's. Oh yeah. It's the 4 C's.
Welcome back to the James Cooley Show. It's your life. I want to clarify something right now, because this young man don't know that starting Wednesday next week, he's not a guest co-host. He will be the co-host on worldwide television, radio, podcast, streaming. So, Doc, just enjoy this last moment right here as a guest co-host, because on Wednesday.
See what he's doing, Robyn? He's trying to stress me out here. But we know that nothing stresses us out. Only the way we think about things stress us out. So, JC, I love you, man.
I know you wasn't ready for that one, Doc. But I mean, for our viewers and our listeners, next week we are going to be in syndicated live Monday through Friday, 12 p.m. See, I messed up already. 2 p.m. to 3 p.m. of Pacific Standard Time. That's Eastern Standard Time, 5 to 6, prime time, all across the world. And we're going to have so many messages to share with you. We're going to have great doctors. Like we got Dr. Tiger here, who will be coming back again. I mean, unless you don't want to, unless you done made her mad. She will be coming back in prime time when we do this, and I'm just so excited about the opportunity that we have. And we are standing to 67 platforms as of Monday or next week. So I just thought I'd get that out there, and I thought I would stress Dr. Mike out just a little bit.
Yeah, I am stressed out. Like Alfred E. Newman of Mad Magazine. What? Me worried? So, Rob, I have a question for Dr. Tiger. So, Robyn, we were talking before about all these things that we can be doing, exercise and eating right and restorative sleep and so forth and so on. How do you handle people who have what I like to call excusitis, an inflammation of the excuse gland, meaning I don't have time for this. I can't do that. I don't have the access to the gym. How do you respond to people who say things like, I don't have time?
I say you're right.
Oh, okay, life coach, tell us.
I say you're right because you don't have time. Because by not taking care of yourself, you are shaving years, months, weeks, days, minutes off of your life. We know from the literature, the research out there, that, as I alluded to earlier, and for those of you that might be listening that don't know what a telomere is, let me just explain that. So, you know what that little plastic piece is on the edge of your shoelace that keeps your shoelace from fraying, that little plastic end? It's actually called an aglet for those of you out there who like word games, right? And so we have these little protective ends of our chromosomes called telomeres, and chromosome is shaped like an X, and so there's 4 little protective ends. And the length of the telomere actually determines how long you'll live. They can actually measure that, do a blood test to measure that and see how long you live. I had it done, and we can talk about that in a bit. And so what we know is that chronic stress, chronic illness, not taking care of ourselves, choosing these poor behaviors prematurely shortens the length of these telomeres, which means essentially you're decreasing the number of years that you're living on this earth. So that is decreasing lifespan, and you're decreasing health span. Health span is the number of years you live on this earth healthy. And we know that most people spend the last 10 to 12 years, physicians included, living a very unhealthy life. And so when someone says, I don't have time, I say, you're right. And then they're like, oh, and then they're listening, right? And so we can talk about the fact that you really don't have time. And then it's my job and my passion to help deconstruct these behaviors and these choices and these tools into very digestible pieces of information that can be utilized even in the busiest of days.
You mentioned blood tests for telomere. Just comment on that quickly, because I'm sure that piqued the interest of some listeners.
Yeah. So right now, let's see, right now I'm 58 years young, I like to say. And earlier in my 50s, when I was 52, I wanted to know what my biologic age was. That means, what do my cells say in terms of my age? How long are these telomeres? I've been reading about them. I've been learning about them for decades, starting way back in medical school. And I was curious. And so I sent my blood away to a lab, and the information came back, and I actually shoved it in the drawer because I was initially kind of worried. The StressFreeMD was stress, right? And so I did open it up, and I told myself that if it gave me some bad information, I had work to do. And if it was good information, I'm going to keep doing the work that I'm already doing. And so, drumroll, the test said that I was 36 years old, which on the inside, biologically, which means that I'm 16 years younger on the inside than how many years I've actually lived on this earth, which means that these behaviors, these choices, these tools, actually work.
And so if our listeners and viewers are interested, they should ask their physicians about how to access this blood test. This is really an important piece of knowledge, and helps get through the excuse that I don't have time. Maybe it's smart to make some time, and we can talk about that. But
well, I got a question now. The way that Robyn just said, when I was in my 40s, I did it, and then now in my 50s, you look like you're 16. I mean, I don't know what you are doing. I mean, you kind of threw me back on that one, because I wouldn't have even thought 50 nothing. So whatever your secret is, you probably need to sell it.
I do frequently hear, I want what you're having, right? And
Right.
so I hand them lifestyle medicine on a plate and I say, here we go. Let's start by starting.
So I know Doc got a question, but lifestyle medicine, holistics, traditional, all of these things plays a major role, including mindset and eating right. Can you talk about that a little bit?
Yeah, so we think about like spokes on a wheel, right? And we need all the spokes on the wheel to be working for that wheel to work. So, I get a lot of people saying, I can't lose weight. Can you help me lose weight? And all they're doing is maybe exercising, right? Maybe they're eating and exercising, but their stress levels are really high, or they're not getting enough sleep, right? Or they're really isolated and lonely. Maybe they're drinking alcohol every night to try and take that edge off. And so what I do is, we really need to dive into what is a day in the life of this human look like, and do a short assessment and see what all the components are that are happening and not happening in their world. And then really get into it and see how can we get all of those spokes of the wheel working to achieve, what they want to achieve.
Dr. Tiger, do you believe that, most individuals, they want to live a stress-free life. However, in their mind, so many people are depending on them, whether it's the patients or whether they have meetings at their, professional environment. And we can empathize if someone's going through a stress period. However, work has to be done. So how would a individual tackle that, saying, okay, my patients are depending on me, my family's depending on me, I don't have time. Yes, I went to a spa last week. It was refreshing, but when I came home, the stress level came back up again. So what are your thoughts on just maybe figuring out a consistent behavior change in order to de-stress?
Yeah, well, it's really changes, right? So it's that whole package. And that's why I think of the human as a whole human, and that whole human needs all of these components. And life happens, stresses happen, little stresses, big stresses. We can't stop life from happening, but we can be calm in the chaos of life. And what it is constantly resetting all day long, resetting our physiology in our body, resetting our thoughts, making sure we're eating foods that don't cause us to be stressed. Food creates mood. So we can eat really healthful foods to help us feel calm and grounded and balanced, or we can eat foods that are processed and full of chemicals and heavy in saturated fats and added sugars. And those things actually make us feel worse, which are the kinds of foods that we crave when we're feeling stressed, interestingly enough, right? So watching the foods we put in our bodies, making sure we're moving our bodies enough, making sure that we have people in our lives that support us, and so on. So it's really important that even on the busiest, most stressful, most horrific days, that we've got the tools to constantly come back to all day long. Going to the spa is wonderful, but that's something outside of yourself, right? That's icing on the cake. But peace is an inside job. Happiness is an inside job. And it begins with you and your choices.
I love that. I'm going to have to steal that and create a commercial.
You get credit.
Happiness is inside. I mean, you're absolutely right. We're going to take another station break. But we're going to come back. We're going to pick it up. And we got a lot more we want to talk about. And I know that no one wants to leave right now, especially me, but we're going to have to tell you what, you want to be part of the conversation. All you have to do is go to the platform that you're watching us on. I promise you, we'll get you an answer. It's your life, and we'll see you shortly after the break.
I never wanna leave. Yeah, I'm right where I wanna be. We got something you and me, and I can't get rid of this feeling. Just like a magnet, we're just like a magnet.
Noah Dingley here, producer of The James Cooley Show, It's Your Life. And the new audio version of James' book, Country Boy, City Boy, A Journey That Ain't Over Yet, is a must-have. James shares his true life story of struggle and success in America. It's both a cautionary tale and a roadmap to achieving the American dream. Get the new audio version of Country Boy, City Boy, A Journey That Ain't Over Yet by James Cooley on Amazon.com or wherever audiobooks are sold.
Hello, welcome back to the James Cooley Show. It's Your Life. And I tell you, just like, our last co-host for the 360 degree of health, we're going to have to let him go as of today because it's going to be the co-host. And I'm excited about that. I'm excited about this. Not just that. We kick off Monday in studio. And Dr. Mike, I think you said you're going to be in studio with me.
Absolutely, of course, yeah. And you invited my wife, and Paula is going to join us.
Oh, yeah. So we are excited about that. And I don't know if if Dr. Tiger, that's the kickoff. That's the word kickoff that day. I don't know if you have time, 5 or 6 minutes. We've seen you stream your link. You can pop up and you can just have fun with us because we're going to be celebrating. And so if you have time and we want you, that is the kickoff for next week. So we would love to have you on air with us if you have a few minutes to talk. But I'm excited about
2 o'clock Pacific time.
Yes. Yeah, so I'm excited about this conversation here. And I know our viewers and our listeners, I see we got many of them watching the show right now, excited about this. And we have to continue to bring great topics, great guests like you, Robyn, to educate all of us and to also let the world knows that even doctors and we are human. A lot of people don't see it that way. And I think that's what Dr. Mike is going to talk about, these 5 steps and all this other stuff during this segment. But I just had to get that out. Hey, Mike, I'm turning it back over to you, bro.
All right. So let's quickly, we don't have a lot of time left in this show, but I want to talk about the role of mindset in initiating behavior change. There may be 5 steps and, we all have our own approaches, but what's the role of mindset? The way we think, how we talk to ourselves, the way we view things. What role does that have in helping us promote our own positive behavior change?
It's extremely important. And, that is the one area that I've noticed over the last several decades that seems to be the block to people making behavior changes, and whether they're making them effectively or not making them at all. And it really starts with, first of all, what's the behavior that needs to be changed? And then I like to look at that trans-theoretical model, which helps define where somebody is in the sense of them changing their behavior. Are they someone that's like, hey, I don't really need to do that? Is it someone that's like, I'm thinking about doing that, or I'm ready to do that in the next few weeks, or I'm doing it. I just started doing it, or, I've been doing it. So really, first of all, like, where is somebody on that continuum? If someone's just doing something because someone else is telling them to do it, it's not going to work. Yeah. Right. And so then where the mindset pieces come in is if that person is game, we need to say, well, how confident are you? And I like to say on a scale of 1 to 10, and how important is this to you on a scale of 1 to 10? And we know from research that someone needs to be at least a 7 in confidence and at least a 7 in importance for that behavior to actually be effective. And then we can actually set the goal. The mistake is that people start setting goals, but they haven't done the work before then, which does begin with their mind.
When I ask those questions and someone says, I'm about a 5, I'll often say, what do you think it would take to go to a 7? And get them to be thinking about that. I've been doing cognitive behavioral therapy and coaching for many decades. Albert Ellis was a teacher of mine. Aaron Beck was a professor of mine at Penn. So it's an area that I'm very, very passionate about. I think that I'll tell you, there's 3 thoughts that I bump up against frequently that block this behavior change. 1, things have to be different. 2, it's horrible that they're not the way I demand them to be. And 3, I can't tolerate this. And when people are thinking like that, well, they put up their walls. So let me ask you quickly about the role of spirituality. You mentioned that very early on in this discussion. It just popped out and we didn't pick up on it. I'm a very strong believer that when we stop, whether it's meditation or prayer or hopefulness or whatever, connecting to a higher power, whatever it may be, that enables us to approach life with a bit more hope, a bit more trust, a bit more acceptance, and it helps us be healthier in many ways. What are your thoughts about that?
Yeah, and I frequently get asked, is this religious connotation? And so it doesn't have to be, right?
No.
It's just this sort of, I like to think of it as the soul, because people understand lots of times the soul is the person that you really are inside, that true person, that true self, the person that if I said to you, who are you? What's important to you? What matters to you? And really, pausing and getting those answers. It's that person, that soul, that spirit, that human being that really needs to be defined. And when you're clear on who that is, then those behaviors can be changed. When you're happy with who that is, when you feel good about who that is, that's when the magic really happens. But we need to get back to that.
You mentioned you're dripping with passion before. This idea of getting in touch with who you really are, that's purpose. And you hear JC, you hear Michelle, they're just like beaming with purpose to bring this energy to listeners and viewers. We have a couple of minutes left in the show. Is there anything that you'd like to help our listeners and viewers point to? You have to point something. How can they connect with you? How can they be in touch with you? How can they follow you? How can they learn more from you?
Well, first, I just want to say, if you are shoulding yourself, like I like to talk about, like, I should know this, I should be doing all this, I just want you to wipe that should off right now.
Right.
Okay. Okay. Because today is a new day. And I just focus on being 1% better every day. And when we just focus on that, amazing things are possible. For me, you can find me at StressFreeMD.net. That's my website, and you'll find lots of information there. There are free videos to get you started to relieve your stress. They're only 5 minutes each because I know how busy you are. My podcast, the StressFreeMD podcast, has 15-minute or less segments to help you relieve your stress. There's a free chat if you want to hop on a call. And if you're interested in online programs, if you're interested in live coaching, if you're interested in retreats, I'm leading a retreat in Africa in January. You'll find all that information there.
Wow, that sounds incredible. All of the great things that you're doing, to help, help others, and that's so important. It's important to me and important to others. Doc, I want to thank you so much for taking the time to come on the show. I meant what I said about Monday. I also meant what I said. If you have time in your schedule, that Dr. Mike is going to be reaching back out to you and get you back on real soon. So thank you so much. Yeah, I'd like to thank Dr. Michelle Cooley for putting together another absolutely fantastic show. I got to thank Dr. Mike. He goes out and get the absolute best guests that he can find. And most importantly, I'd like to thank our viewers and our listeners for taking time to tune into the James Cooley Show. It's Your Life. Remember to always dream big, think big, and be big at everything you do. We'll be back tomorrow. Same time, same place. Remember, is your life. We'll see you then.
He's listening to music. We don't hear it. He hears it.
I know. Where's the music?
Wow, hear it.
I have to. I'm about to figure this out because, you know,